Welcome back, nursing students. Today, we're diving into some high-yield pediatric concepts. From eye infections to heart defects, let's break it all down in a way that's simple, clear, and easy to remember. Conjunctivitis pink eye. Let's start with conjunctivitis, commonly known as pink eye. It's inflammation of the conjunctiva caused by viruses, bacteria, allergens, or irritants like smoke or chemicals. To prevent it, wash your hands often, avoid touching your eyes, and never share eye makeup or contact lenses. For newborns, watch for ophthalmia neonatorum, caused by gonorrhea or chlamydia during birth. Symptoms: swollen eyelids, yellow-green discharge, and crusty eyes. Treat it promptly with erythromycin ointment. If left untreated, it can lead to blindness. Retinoblastoma. This is a rare, malignant tumor of the retina, usually in young children. Symptoms: white glow in the pupil leukocoria, double vision, eye pain, and vision loss. Diagnosis is done through eye exams and imaging. Treatment may involve surgery and supportive care. Families should follow up regularly and help the child rest and eat well, preventing hearing loss in children to reduce the risk. Vaccinate against measles, mumps, rubella, and meningitis. Avoid loud environments. Ask doctors about ototoxic medications. Retinopathy of prematurity (ROP). ROP affects preterm babies, especially those born before 31 weeks. The blood vessels in the retina grow abnormally. Risk factors include apnea, heart disease, infection, and low oxygen levels. It's managed with oxygen therapy, aiming for safe saturation levels. Otitis media, middle ear infection. Common signs: ear pulling, fussiness, fever often 104 degrees Fahrenheit, and sometimes drainage. Treatment includes antibiotics, ear drops, and possibly myringotomy tubes. Tinnitus, ringing in the ears. Common causes: loud music, smoking, anemia, and certain medications like loop diuretics and aminoglycosides. ADHD, attention deficit, hyperactivity disorder. 3 types: inattentive, hyperactive, impulsive, combined. Symptoms include distractibility, trouble following instructions, excessive talking, and difficulty sitting still. Diagnosis includes professional evaluation and input from teachers. Treatment includes behavior therapy and medications like Adderall or Ritalin. Tip: small changes in the classroom can help manage symptoms. Autism spectrum disorder (ASD). ASD shows up in early childhood with social and communication difficulties and repetitive behaviors. Signs may include no eye contact, delayed speech, and preference for being alone. Treatment: early intervention, therapy, family training, and sometimes medications. Nursing tip: be patient, minimize touch, and maintain routines. Eating disorders: anorexia nervosa, extreme calorie restriction. Symptoms: rapid weight loss, cold intolerance, hair loss, and amenorrhea. Bulimia nervosa, binge eating followed by purging. Binge eating disorder, eating large amounts without purging, often linked to stress. Pica, eating non-food items like dirt or chalk, often linked to anemia. Respiratory distress in infants. Look for nasal flaring, head bobbing, cyanosis, retractions, and grunting. Treatment depends on severity, may include suctioning, oxygen, or CPAP. Epiglottitis, a medical emergency. Signs: drooling, anxiety, inspiratory stridor, and restlessness. Never stick anything in the mouth. Keep the child calm. Prepare for airway management. Prevention: Hib vaccine at 2, 4, 6, and 15 to 18 months. Congenital heart defects, cyanotic defects, tetralogy of Fallot. Transposition of the great arteries, truncus arteriosus, HLHS. These involve mixing of oxygenated and deoxygenated blood. PG1 keeps the ductus arteriosus open to allow blood mixing. It's critical before surgery. Tetralogy of Fallot equals 4 defects. VSD, pulmonary stenosis, overriding aorta, right ventricular hypertrophy. Watch for TETS bales. Place the child in an E2 chest position and give oxygen. Acyanotic defects includes ASD, VSD, PDA, AV canal defect. These usually have a left to right shunt, leading to increased pulmonary blood flow. PDA murmur sounds like a machine like hum, treated with indomethacin or surgery. PKU phenylketonuria, an inherited disorder. Body can't break down phenylalanine. Untreated, it leads to brain damage. Diagnosis is through newborn screening. Treatment, special diet with no meat, dairy, or high-protein foods. Kawasaki disease, an inflammatory condition in kids with high fever. Strawberry tongue and rash. Main concern, coronary artery aneurysms. Treat early with IVIG and aspirin. Pediatric heart failure. Signs, tachypnea, tachycardia, crackles, edema, and ascites. Intervention, daily weights, fluid management, and medications like furosemide. That's a wrap. If you found this helpful, don't forget to take notes, review with a classmate, and quiz yourself on the science, treatments, and nursing care. Outro music. Thanks for learning with us. You've got this. Stay confident, stay compassionate, and keep studying smart.